Team HPV Cancer-Free, implementing a multimodal approach to increase HPV vaccination rates in the ambulatory setting, Phase 1. Nearly 80 million Americans are infected with the human papillomavirus. Improvements in HPV immunization rates leads to decreased HPV infections, which most commonly cause cancer. The Center for Disease Control Advisory Committee on Immunization Practices recommends routine vaccination at age 11 or 12. However, HPV vaccination has decreased uptake due to parents' perception and lack of education provided about the vaccine. Our project scope was boys and girls age 11 and 12 who were seen for a well child visit with a primary care physician documented in EPIC during the measurement period. At baseline, shown in Figure 1, 32.5% of our 11 to 12-year-olds seen for a well child visit received the HPV vaccine. To determine reasons for low vaccination rates, we reviewed the literature and met with parents. Reviewing literature studies identified beliefs and reasons for low HPV vaccination. Our local hospital's Family Advisory Council verbalized similar sentiments and enlightened our perspective. Our takeaway was that education and a strong provider recommendation were proven to increase vaccination rates. To get the perspective from our physician members, we created and conducted an anonymous survey to determine their perception of why HPV vaccine uptake was not at benchmark levels. Figure 3 highlights our survey's results. Physician responses confirm literature findings. Public perception was the largest barrier to uptake of HPV immunization. To ensure a strong provider recommendation, physician and clinic staff were provided with education on how to discuss HPV cancers and recommend vaccination. Training included discussing vaccination according to the CDC's presumptive bundled approach, where HPV vaccination is recommended in the same way and on the same day as other adolescent vaccines. Additionally, access was given to our own homegrown role-playing videos starring one of our own pediatricians who demonstrated an effective recommendation and fielded commonly asked questions, providing an interaction simulation. Parent-focused HPV vaccine informational clips were also distributed to all of our designated practices to be placed in each exam room. We also measured provider individual immunization rates and compared to national benchmarks. Unblinded provider-level data was shared with all the providers in our cohort and is continually shared on a quarterly basis. We also changed a best practice alert in our electronic medical record by defaulting a checkbox to on for HPV vaccination in an EPIC Smart Set. Our goal was to stimulate recognition that the vaccine was recommended for that age during the physician-patient encounter. We utilize various social media outlets to promote HPV awareness: Facebook, Twitter, and WGN Radio, where our pediatrician champion discussed HPV vaccination. Our multidisciplinary team membership and multimodal approach resulted in an increase in HPV immunization rates. As demonstrated in Figure 4, as of June 2020, our rates are up to 65% from our initial rate of 32.5%. Figure 5 shows variations in HPV rates noted by medical specialty. We are targeting future interventions to address these differences. Our team continues to meet monthly and engages our physicians and staff with education and validated best practices to improve HPV vaccination. Table 1 outlines our enduring and future interventions. Factors that were critical to the success of our project was a multidisciplinary team, actively engaging physicians with education and validated best practices, and accountability aided by providing physicians with their own individualized, unblinded HPV immunization rates. The CDC's HPV vaccination coverage estimates demonstrate that HPV immunization rates are increasing. However, 51% of adolescents have not completed the HPV vaccine series. Our project's evolution will be to focus on ensuring patients complete the vaccine series, which is 2 doses by age 13. We are also considering changing our parent-facing educational materials to promote vaccination initiation at age 9. The CDC recommends 2 doses of the HPV vaccine for all boys and girls age 11 and 12. However, the series can be started as early as age 9. The American Cancer Society has updated its guidelines for HPV vaccination, recommending healthcare providers routinely offer the HPV vaccine series to boys and girls between ages 9 and 12. As pharmacists, we continue to be valued members of the healthcare team and should play an active role in population health initiatives. Our project beginnings stem from an HPV vaccination presentation given by our pharmacists during an ambulatory pharmacy and therapeutics subcommittee meeting. The topic spurred the interest of one of our pediatrician members who was surprised at how low our HPV immunization rates were based on commercial claims data.